Wisconsin has a proud history when it comes to investing in the well-being of children and families. Our organization was founded over 130 years ago by forward-thinking people in our state who saw a need to bring together leaders from various walks of life to study the practices that work best in improving the lives of disadvantaged kids and bring that knowledge to the attention of policymakers. Our name and focus have evolved over the years as conditions in the state have changed, but our mission statement captures a vision that has remained constant throughout: to ensure that every child in Wisconsin has the opportunity to grow up in a just and nurturing family and community. We work on three main fronts: research, public education, and policy advocacy, leading to improved outcomes for children and families. Our work is research-based and data-driven. That means we use our expertise to connect with the most respected experts on children's issues in the country, engage the public through a comprehensive media and social media strategy, and work directly with elected officials and other key decision makers to bring about the changes necessary to fulfill our mission. Our biggest strength and what sets us apart from other organizations in our state is the depth and breadth of expertise among our staff. The Council is known throughout Wisconsin as the go-to organization for the best data and policy knowledge in several areas, including child care, health care, juvenile justice, and fiscal policy. There are other people in the state who know about these issues, but no other organization approaches WCCF's range of expertise, working with the single-minded goal of making things better for the kids and families in the areas that matter most. In addition to the expertise of our staff, we owe a lot of our success to the effectiveness of the coalitions we build or join. We play a key role in core areas like childcare, healthcare, and the state budget, and a supportive role in areas such as after-school programming and domestic violence reduction. Working in this way expands our reach dramatically. The only measure of success that really matters is whether our work improves the lives of Wisconsin's children. We measure that using data like the number of uninsured children and the number of kids in high-quality childcare settings. For example, Wisconsin is a top-tier state when it comes to child well-being and has one of the highest levels of health insurance coverage in the nation. But other measures, such as the increase in childhood poverty, tell us that we still have work to do. Because of our name, a lot of people mistakenly assume that we're a state agency. In reality, our credibility is rooted in our independence. We're not beholden to any special interest other than what is best for kids. We work with and against administrations and legislators of all political stripes. Another thing some people don't understand about WCCF is that we don't provide direct services. Advocacy is an unfamiliar business to a lot of people. We work in collaboration with many organizations that directly serve families, and those partnerships help inform our work. But our work could be enhanced if more people understood the kind of systemic change needed to affect the thousands of children and families in our state, in addition to the one family at a time help they get from agencies we're allied with. The Council has been instrumental in some of the most important children's policy changes in our state. We've been key players in big improvements to our healthcare program, Badger Care, and we're a driving force behind the creation of YoungStar, our quality rating and improvement system for childcare. These programs improve the lives of hundreds of thousands of Wisconsin's children. Our biggest internal challenge is simply capacity. We just don't have the staff and resources to do everything that needs to be done. Our ability to do statewide outreach is limited, and there are some issues that we should be working on that we simply don't have the time and person power to address. Externally, the challenge is that we work in a world ruled by politics. We take our nonpartisanship very seriously, but unfortunately, it can be difficult to advocate for kids in an increasingly partisan environment. But rather than discouraging us, it reinforces the importance of our efforts to ensure that we are a strong voice for kids in the Capitol and across the state. Effective public policy change requires three components: quality analysis, effective messaging, and robust coalition building. While we have strong analytics and are improving our messaging, we need to strengthen our coalition building. This requires a particular skill set that's not all that common in the public policy arena. With additional resources, WCCF would invest in increasing our coalition building capacity. There is currently no sustained focus on reducing childhood poverty in Wisconsin, which is increasing in our state at 2.5 times the national rate. Income inequality is also growing in Wisconsin. While the income of the top 1% has increased dramatically over the last 15 years, earnings of the bottom 40% have actually decreased. Children who grow up in poverty are at much greater risk of school failure, serious health problems, shorter life expectancy, higher unemployment, and lower lifetime earnings. Reducing childhood poverty is a moral imperative with an economic payoff. With additional funding, WCCF would develop and implement a statewide child poverty reduction plan.